Hi everyone, you're listening to the Haider Rifaat Show, and I'm your host, Haider Rifaat. Today on this podcast, I've invited Michael Kugelman. He is the Senior Program Associate for South Asia at the Woodrow Wilson International Center for Scholars in Washington, D.C. And the topic we'll be discussing at length is COVID-19 and the US government's response to it so far. Thank you so much, Michael, for joining me. I'd like to first ask you, what precedent does the current pandemic set for the upcoming presidential election in the US?
Yeah, I think it's quite simple. So far as I know, there has never been a presidential campaign here in the U.S. where the campaign was essentially suspended for a long, indefinite, unknown period of time. And that's exactly what's happened right now, of course. The only campaigning that we're having is via the internet, online. President Trump had continued to campaign for quite some time, even when the pandemic had become in place in the U.S., but now that's stopped as well. And I think that the advantage goes to the incumbent here. It's the challenger. It's essentially Joe Biden that needs to be the one out there sort of connecting with voters and trying to make his positions known. And that's something that he thrives with, too. He's sort of like Bill Clinton in the sense that he likes to be out there with a lot of people, connecting with people, generating an energy in large campaign events, but none of that is happening. So I think that really is the challenge, is how do the two candidates go about this reality of entering really the most important stage of the presidential campaign, where they cannot actually be out there campaigning. It's going to be a big challenge, especially with the Democratic and Republican conventions coming up in just the next few months.
Right. Now, at least 2,300 nursing homes in the United States have reported positive cases of COVID-19, with 3,000 deaths. The nursing homes in the US currently have 1.3 million active residents. Since the rate of incidence of this disease is higher in aging adults, it is important for countries, including the United States, to include nursing facilities in their approved tallies. Why, according to you, is there a substantial disconnect between the numbers that are being reported and the actual figures?
So your second question is about nursing homes in the U.S., and this is critical because indeed, as you suggest, a very large number of cases of coronavirus have emerged from these nursing homes, which essentially are incubators of the coronavirus in the U.S. It's really hard to answer these questions about discrepancies and reported versus actual figures. We're looking at a national emergency that is so large and so complex that I think it's going to be a very long time before we have a much better handle on the extent of the scale of this virus, both in terms of numbers of cases and the numbers of deaths. The U.S. simply is not used to this type of emergency, and it's almost surreal. Even now that we've been in the throes of this incredibly deadly pandemic for so long, it's surreal that we've been having days on end where hundreds and at times several thousand Americans die every day. And I think given the scale and the deadliness and the complexity of this pandemic in the United States, I just think it's going to be a long time, perhaps not until the pandemic has finally gone away, until we really know the full extent of and the full human extent, or the extent of the human costs of this pandemic. It's going to be quite some time.
Now, during such testing times, why are China and the United States putting the blame of this pandemic on each other? Shouldn't both the countries come out in support of each other for the greater cause of humanity?
This is really the first question that really comes up when trying to get our hands around this coronavirus challenge. Why aren't the two most powerful countries in the world working together to try to combat it? And I would answer that the answer is very simple, and that is that these are two governments, or should I say two regimes, that simply are not interested in global cooperation, are not interested in multilateralism, should I say. Certainly, to be sure, the U.S. Has long been seen, as the world's sole superpower, as the country that needs to take the lead, take the initiative to galvanize and oversee global responses to complex global emergencies that affect the world on the whole. And we saw that in the case of some of the previous pandemics that were not as serious as the one that we're facing now, Ebola, for example. It happened when President Obama was in power, and he was credited for doing a lot to try to organize global responses to that pandemic. But we're looking at an administration now that is so different from anything that we've been used to for so many years, so many decades, and clearly President Trump thumbs his nose at the world order as we know it, and he thumbs his nose at this notion of necessary U.S. responsibility as the world's sole superpower. He simply is not interested in that. Now, to be sure, the U.S. government has trumpeted its efforts to provide humanitarian assistance. A few days ago, the State Department released a statement that laid out all of the countries that are getting humanitarian assistance from the U.S. and how much it was getting. And the idea there was to emphasize that the U.S. really is doing something, contrary to the critique. But I think that it's quite clear that messaging from the U.S. government was meant to push back against this suggestion that it is China that is trying to lead global responses. And China has indeed done quite a lot with its own provision of supplies and all that. China, of course, unlike the United States, has long eschewed this notion of multilateralism. It does not take part in most multilateral discussions, whether you're talking about things like climate change negotiations or, transboundary water discussions. It does not get involved in those types of things. So it's not a surprise that China doesn't want to get involved working with the U.S., but it really is a shame that at a time when you have this unprecedented crisis and you really need the two countries working together, they're not. And I think that China and the U.S. need to set the standard. They need to show the way forward. And yeah, there have been some separate efforts to try to generate some degree of multilateral activities. Some of the European countries have tried to do this. The G20 convened a meeting several weeks back to talk about shared responses. Of course, Prime Minister Modi of India brought together a video conference that involved the leaders of all of the South Asian countries. But those are piecemeal and they're relatively modest. I think that the notion of a robust, sustained, lasting global response can only go so far as the U.S. and China are willing to take it. And at this point, the U.S. and China are really not wanting to talk to each other, not wanting to deal with each other. The relationship is probably the worst state it's been in quite some time. And it really is a shame.
Now, President Trump also wishes to relaunch the economy amidst this pandemic in early May. Do you not consider this a rather premature political move on his part that can potentially harm more lives in the process?
I think this is a misguided move. To be sure, I'm not a health specialist. I don't want to overstep my bounds here. But given that the numbers are still incredibly high, given that the cases, the deaths are still there, happening in very large numbers in the U.S., the idea of ending or even easing social distancing in large portions of the country to get the economy going again, to me, from a public health perspective, it sounds like a really bad idea that in a worst case scenario could generate a huge number of deaths. And it is a purely political move on the part of President Trump. He knows that his support base, his rank and file, conservative Republicans, they want the economy to get going, and certainly they are worried about their economic well-being. This is why in recent days we've had a number of Trump supporters that have gathered in state capitals around the U.S. calling for the lockdowns to be lifted and for the economy to reopen. Trump knows that. He's known about this discontent even before these protests were happening. He does not want, in an election year, when he cannot be in a position to campaign, he does not want his rank-and-file support base to be feeling the economic strain or perceiving that it will soon feel the economic strain. There's been a number of figures, conservative figures, that have said what to me seem like some rather troubling things, including one Trump Republican that said, I would rather die than know that my economy is going to collapse. So in other words, this person was suggesting that it's better to open America up, even if that risks more deaths, as opposed to keeping America closed and minimizing the risk of deaths. And I think that this whole idea could perhaps be, American capitalism run amok, or sort of like the Max Weber notion of Protestant work ethic running amok, this notion that the economy is the most important thing. Now, to be sure, people are suffering in the U.S. We hear about this idea that it's in the developing world where you have to make these hard decisions between locking down and keeping things open for those that really need to work. But, in the U.S., we've got a lot of poverty here. We've got a lot of people down on their luck, a lot of people hovering around the poverty line who certainly suffer if they can't work for a few days on end, much less a few weeks on end. So it's tough. But I do think that President Trump is acting rashly, and he is being guided uniquely by political considerations that in the end, I think could backfire, because let's face it, if he does open the economy back up again, people start working again, if people get sick again, if there are more deaths, well, that second wave of coronavirus deaths could add to the economic strain that's already there, and in effect cause even more problems for an economy that President Trump badly wants to reopen.
We also know that the Chinese government knew about the virus long before they made it public. Will things have been much better in terms of medical and political preparedness in combating the virus had the world known earlier on?
It seems quite clear that the Chinese were aware that something was happening with the coronavirus, and they did not act quickly enough. And then when they realized that they were causing problems by not acting quickly enough, they suppressed information about what was going on. And then, of course, the rest is history. This is not the first time. This is really a case of history repeating itself. We know that in recent years, when there have been other pandemics that have started in China, SARS, for example, China also suppressed information. And certainly, given how quickly COVID-19 spreads, every minute that you don't act is a wasted minute and causes more risk. And certainly the fact that China did not act more quickly and the fact that that inaction contributed, if not drove, the very spread of the coronavirus around the world. And I think that China knows this, and this is sort of a question that could be asked: why is China going out of its way? Why is China doing all this PR to broadcast to the world that it's providing all these supplies to countries that are really in the throes of the virus? Why is China saying that, trying to say, well, we managed to reduce the severity of the virus. Here's how you can do it too. We could understandably ask, why is China saying things like that when China itself really caused a lot of problems by not acting well at all, not acting quickly, not acting with alacrity, not at all being a template for how best to respond to this virus. I think that China feels guilty to an extent. It understands it made a mistake, and it wants to try to tell the world that not only is it willing to help to try to ease the crisis in other countries, but that there can be lessons learned from what it did do right once it finally did get its act together and started acting to curb the virus. Certainly there are strategic components as well. China certainly, I think, wants to take advantage of a crippled United States, which not only is not in a position to lead from the front in the global response, but also has no desire to lead from the front. And I think China does want to step into the fold and add to its already strong influence and presence around the world. But we don't want to second guess. Who really knows what could happen? But certainly I do think if China had been in a position to respond to the coronavirus more quickly, if it had nipped it in the bud more quickly, if it had acted more robustly, then maybe we wouldn't be looking at a pandemic, or we wouldn't be looking at a pandemic that would be as severe and deadly as we've had now. We may never know, but I think there's a fair reason to think that's the case.
Coming back to the US government, what should be a realistic, long-term plan aside from the already imposed government lockdown that assures a safety net for low-income families in the United States and around the world?
That's a very good question about what the best U.S. long-term policy should be to not only address the pandemic in the U.S., but also ensure that low-income folks get the help and the relief they need. Um, yeah, I think that what what has to happen first, not to state the obvious, but it's important to, is that you need to ramp up the testing and the contact tracing and the quarantining and the social distancing to do everything possible to bring the numbers down. After that, I think that you need a truly robust and generous economic recovery plan, which quite honestly needs to apply not just to the low income folks, but also to middle income. You've got a large middle class in the United States that is getting hit hard and will continue to get hit hard. But you need to provide payments to households as quickly as possible. And the U.S. government has promised to provide a certain sum of money to households that need it, and yet there have been a lot of delays in moving forward in that regard. I think that what you need above all else is for the U.S. government to defer the U.S. government needs to, the U.S. central government needs to defer to the state governments, to the governors, who have really done a great job for the most part. Let them decide how they want to help those most in need. But the U.S. government, the U.S. federal government has the money for that. The U.S. government has to be willing to put up the money once governors have a plan. I think that is absolutely essential. We live in a world where all politics, not only all politics, but state services, service provision is local. It's state-based. It's provincially based. It's not federal. Healthcare is, of course, in a country like Pakistan, health is a provincial matter. And in the U.S., it's no different. That we've seen that it's been in the states where the governors have been taking the lead and doing a lot of great things, from communicating accurate, truthful, credible, data-based information to the publics, to doing whatever is necessary to get the amount of tests. I mean, in the state that I live in, Maryland, the Maryland governor did something extraordinary, where he managed, with the help of his wife, to get 500,000 tests flown in to the Baltimore Washington International Airport on a Korea Air jet. These are tests that came from South Korea. The governor of Maryland's wife is from South Korea originally, so she used her contacts. Ideally, you wouldn't need a state governor having to do something like that, but such is the unease and the mistrust of the states about the federal government and the Trump administration and its ability to take the right steps with this crisis. You've had governors stepping up. And so I think that's why, go back to what I said before, and I'll conclude here, to be sure, it's the U.S. central government that needs to provide the money, and it needs to provide as much money as needed to low-income households. But you need to have governors involved on very direct levels, figuring out how these plans should work, how much money, and so on. And then you look to the Trump administration for the money. Now, of course, that may not be how the Trump administration sees it, but I think what I would want to do is emphasize the importance of state-level responses here in the United States, not just in terms of responding to the crisis from a public health perspective, but how to respond economically and how to bring relief packages and the like to those that need it the most.
And very lastly, Michael, there is still a lot we don't know about COVID-19. The virus can stay on face masks for up to a week. Some hand sanitizers with below average levels of alcohol may also be ineffective. Do you think wearing face masks and using hand sanitizers may not be the best of all solutions to ensure public safety? Do we perhaps need to do more research on the mysterious virus? What is your understanding of this?
Indeed. There's so much that we don't know. There's so much that surprised us. There's so much that we don't know. We really don't know about proper treatment. We don't know if the drugs that some have touted as the best drugs to move forward are really the drugs that can work. We don't know how long it's going to be before there's a vaccine available, though certainly it's being worked on. I think that at a point like this, when you have so much uncertainty, you really need to trust the experts. And this is why whenever President Trump has his daily press conference and he gets up on the stage, interestingly not practicing social distancing with others there with him, there's this coronavirus commission that he is put together that's led by Vice President Pence. I really don't listen to anything that anyone says during those press conferences, except for Dr. Anthony Fauci, who, of course, has become a real celebrity. He's a top infectious disease specialist, a medical doctor. I listen to him. When I'm trying to read information about the coronavirus, I don't read the reports that the political reporters publish with the New York Times and the Washington Post. I read what the medical doctors are saying, the op-eds written by the doctors, the epidemiologists, the scientific researchers, all of them. And indeed, there had been some inconsistencies in the guidance coming from the U.S. government about whether to wear face masks. I mean, for so long, we had known that around the world, particularly in Asia, people had worn masks from the start, whereas, the U.S. government was saying, you don't need to wear masks unless you have the coronavirus or think you have it. But now the messaging has changed. Now the U.S. government has said that maybe you should wear them, but it's still your choice. I remember being in airports, in very crowded airports in India and in Pakistan in February of this year, when the coronavirus was starting to get serious, and everyone around me was wearing a mask. I didn't have one on. I regretted not having one on. Luckily, I didn't get coronavirus, but I remember thinking, gee, is my government not doing something right? Is it not listening to the experts that it needs to listen to? I think that practicing an overabundance of caution is the best way forward. So, yeah, we don't know for sure how effective masks can be, but certainly there's nothing wrong, in my view, with putting a mask on when you're going out in public. If you cough, the mask is going to catch some of the cough. If you're breathing heavily, the mask is going to protect others near you. Same with hand sanitizer. You use it as much as possible, and just wash your hands above all else. And I think that we have to be as cautious as possible. Every time I get an order of groceries delivered to me, I take an antibacterial wipe and wipe off every single grocery product, even though there has not been any medical evidence showing that you can actually get coronavirus from your tomatoes or from your can of beans. But it cannot hurt to be as cautious as possible. I think that's really, for me, the watchword is practice an abundance of caution. Don't open the country up sooner than you need to. Don't take any shortcuts with sanitation and hygiene. Wash your hands as much as possible. Wipe everything off, clean everything off, and then wash your hands again.
Thank you so much, Michael. It was a pleasure having you on the show. That is all for now. Stay tuned for more information and more weekly videos on my official YouTube channel and Facebook page. Until then, take care. Bye-bye.